Have you ever heard the words thyroid cancer and wondered why it feels like more people around you are being diagnosed than ever before? You're not imagining it. Today, over 500,000 people are diagnosed with thyroid cancer every year worldwide, and the numbers are still rising. So, what's going on? Well, I'm here to explain exactly why this type of cancer is being detected more often, what the key risk factors and warning signs are, and perhaps the most overlooked part, how your diet may be quietly impacting your thyroid health without you realizing it. As a doctor who spent decades treating thyroid conditions, I've seen the same questions come up again and again. Is my thyroid nodule dangerous? Can what I eat make it worse? Are there any supplements that actually help? And today, we're going to walk through all of it, clearly, calmly, and with your well-being in mind. So if you've been diagnosed with a thyroid nodule, have a family history of thyroid issues, or just want to understand what's happening inside your neck and why, it's time to pay attention, because sometimes a small lump can tell a big story. Let's begin.
Why is thyroid cancer on the rise? First, let's be clear. This increase isn't only because more people are getting sick. One big reason we're seeing more cases today is because we're getting better at finding them. With the widespread use of thyroid ultrasounds, CT scans, and MRIs, even when ordered for other health issues, doctors are now spotting small nodules in the thyroid that would have gone unnoticed years ago. Many patients discover these lumps entirely by accident. One day you're having a scan for your sinuses or a neck muscle strain, and suddenly, there it is, a suspicious nodule. In my own clinic, I've seen a dramatic rise in people coming in for thyroid checkups, not necessarily because of symptoms, but because they're more aware, or they've heard about it from a friend, family member, or even social media. This awareness is good, but it also means we're detecting very small cancers that might have never caused a problem.
The hidden link between obesity and thyroid cancer. Now, let's talk about something that's not just about detection: lifestyle. Over the past 2 decades, global obesity rates have soared. And here's something most people don't realize. Fat tissue isn't just stored energy, it's metabolically active. It actually produces hormones and inflammatory substances that can fuel cancer growth. Studies have now linked obesity not only to thyroid cancer, but also to breast, colon, and prostate cancers. In other words, when your body carries too much excess fat, it creates a biological environment that's more likely to encourage abnormal cell growth, including in the thyroid. It's not just about weight on a scale, it's about the silent hormonal shifts happening inside the body. And when those shifts combine with existing thyroid nodules or genetic predisposition, the risk goes up.
Why you shouldn't panic over thyroid nodules. Here's something that surprises most people. Thyroid nodules are incredibly common, especially in women. In fact, in women of childbearing age, nearly 1 in 2 will have at least one nodule. That's right, half. But before you worry, here's the good news. Most of them are completely benign. The key is knowing which nodules deserve closer attention. Doctors look at several factors during an ultrasound. Is the nodule growing quickly? Does it have irregular edges? Is there blood flow inside it? Is it darker in appearance? We call this hypoechoic. Is it taller than it is wide? All these features help us calculate the risk using a system called TIRADS, or Thyroid Imaging Reporting and Data System. It's a bit like a traffic light system: green for low risk, yellow for uncertain, red for high risk. Just remember, having a nodule doesn't mean you have cancer. But if the features suggest concern, it's time to investigate.
7 warning signs of thyroid cancer you shouldn't ignore. Let's now walk through the most important part: how to recognize when a thyroid issue might be more than just a harmless lump. While most nodules are benign, some signs and symptoms can raise red flags, and catching them early makes all the difference. 1. A suspicious thyroid nodule. We touched on this earlier, but let's be more specific. If you have a single nodule that is growing rapidly, feels firm, or looks irregular on ultrasound, especially if it has microcalcifications or blood flow in the center, it deserves investigation. In contrast, people who have multiple small nodules often have a benign condition called multinodular goiter, which is far less concerning. But a solitary nodule that is taller than it is wide or darker in texture, what we call hypoechoic, may carry a higher risk of being malignant. If you've been told you have a nodule, don't panic, but do ask your doctor if it meets any of these criteria. 2. Swollen lymph nodes in the neck. Lymph nodes often swell when you're sick, like during a cold or sore throat. But if the swelling lingers, especially in the lower front or side of the neck, and you're not fighting an infection, it needs attention. Cancerous cells from the thyroid can travel to nearby lymph nodes early on. If you have both a thyroid nodule and enlarged neck lymph nodes, this combination increases the need for further testing. 3. Hoarseness or voice changes. Your voice is controlled by a delicate nerve that runs right alongside the thyroid gland. If a growing nodule presses against this nerve, called the recurrent laryngeal nerve, it can cause hoarseness, voice cracking, or a weak voice. I've had patients come in saying, "Doctor, I didn't even realize how different my voice sounded until someone pointed it out." That's often a subtle but significant clue. If your voice changes and doesn't improve over time, especially in the absence of a cold or allergy, don't brush it off. 4. Difficulty swallowing. When a thyroid nodule becomes large or positioned in a way that presses against your esophagus, it can cause a very specific kind of swallowing difficulty. Here's how to tell if it's thyroid-related. It usually starts with trouble swallowing solid food and gradually worsens to include liquids. That's the opposite of swallowing issues caused by neurological conditions, where liquids are harder first. If eating feels uncomfortable or tight in your throat, especially with solid food, it's time to speak to your doctor. 5. Pain in the neck or thyroid area. The thyroid itself isn't supposed to hurt. So if you feel sharp pain when touching the neck or discomfort when turning your head, that's not normal. Some patients describe it as a dull ache or pressure. Others feel it as a sudden jab. Either way, pain in the thyroid area deserves a deeper look, especially if paired with other warning signs. 6. Shortness of breath, especially when lying down. Your trachea sits just behind the thyroid. If a thyroid mass becomes large enough, it can press against your airway, making it feel harder to breathe, particularly when you're lying flat. You might notice a sense of tightness in your chest, or find yourself propping up more pillows at night to sleep comfortably. Shortness of breath from thyroid pressure is a late symptom, and it should never be ignored. And 7. A persistent, unexplained cough. Lastly, a lingering cough that won't go away, especially when there's no infection, no allergies, or no smoking history, could be coming from a thyroid nodule irritating the throat or pressing nearby structures. Some of my patients have said, "It's like a tickle I can't clear." If this sounds familiar, it's worth checking out.
What should you do if you notice these signs? If you're experiencing any of the signs we just discussed, whether it's a lump, hoarseness, trouble swallowing, or something that just doesn't feel right in your neck, don't wait. Early action can make a real difference. Your first step should be to see your primary care doctor or an endocrinologist, the specialist who treats thyroid conditions. From there, the doctor may run several key tests. Thyroid hormone blood tests. These check whether your thyroid is overactive, underactive, or producing hormones normally. Ironically, most thyroid cancers do not cause hormone imbalance, so a normal thyroid function test doesn't rule out cancer, but it still gives us important context. Ultrasound imaging. This is the most useful tool we have for evaluating nodules. A skilled radiologist can measure the nodule's size, shape, and texture, and identify any red flag features like microcalcifications or abnormal blood flow. Fine needle aspiration biopsy, or FNAB. If the ultrasound shows a suspicious nodule, your doctor may recommend this procedure. It's quick, relatively painless, and highly accurate. It involves using a thin needle to collect cells from the thyroid nodule for microscopic analysis. Depending on the results, your care plan may include close monitoring, surgery, or even no immediate action if the risk is low. Remember, not all nodules require surgery. In fact, many are just monitored with follow-up ultrasounds every 6 to 12 months.
Can diet affect your thyroid or increase cancer risk? This is one of the most common questions I hear from patients, and the answer is both yes and no. Let's start with the myths. There's no magic thyroid detox or miracle supplement that will activate your thyroid and melt nodules away. Despite what the internet may tell you, these products often do more harm than good, wasting your money and sometimes interfering with real treatment. But food does matter. In fact, certain key nutrients are essential for healthy thyroid hormone production and function. Selenium helps convert thyroid hormone into its active form. Zinc supports hormone production and immune function. Iron, critical for hormone metabolism, yet often overlooked. And iodine, needed in small amounts to make thyroid hormone, but in the US, most people get enough from iodized salt. Where can you find these nutrients? You don't need exotic powders or imported supplements. They're right in your kitchen. Eggs, seafood and fish, legumes like beans, lentils, and chickpeas, oats and seeds, chia, flax, sunflower, and pumpkin, leafy greens, spinach, arugula, lettuce, red meat and organ meats, a good source of iron. And yes, broccoli and cauliflower are safe. You'd have to eat several pounds a day to see a negative effect.
Supplements versus treatment. Know the difference. There's a big difference between taking a supplement and taking thyroid hormone replacement. If you've been diagnosed with hypothyroidism, especially autoimmune forms like Hashimoto's, your body simply isn't making enough hormone. In that case, your doctor may prescribe levothyroxine, which is a carefully controlled medication, not just a supplement. This treatment replaces what your body can't make and is essential for maintaining energy, weight balance, and heart health. So don't confuse it with over-the-counter thyroid boosters, which often contain unregulated ingredients and should be avoided unless approved by your physician.
Be proactive, not afraid. If you've made it this far, first of all, thank you. It means you care about your health and you're taking the right steps. Let me reassure you one last time. Most thyroid nodules are not cancerous, and even when they are, thyroid cancer is often very treatable, especially when caught early. So don't let fear keep you from getting checked. Let curiosity and self-care lead the way. If you've noticed any of the signs we discussed, or if you've been told you have a thyroid nodule, talk to your doctor. Ask questions. Request an ultrasound. Advocate for yourself. And if you've been diagnosed with a thyroid condition and feel overwhelmed, know this, you're not alone. Many of my patients have gone through the same journey and are now living full, healthy lives with the right care and support. Let's keep the conversation going. I'd love to hear from you in the comments. Do you have a thyroid nodule or hormonal issue? Are you currently taking thyroid medication? What city or state are you watching from? Drop me a comment below. If you found this video helpful, please give it a like. It helps the platform show this content to others who might need it. And if you haven't subscribed yet, now is a great time. I post weekly videos on thyroid health, metabolism, diabetes, nutrition, and healthy aging. Hit that subscribe button and turn on the bell so you never miss an update. Until next time, stay curious, stay kind to your body, and remember, small choices today can protect your health for years to come.